Good evening. Good evening. Engineer Moore.
Good evening,
Thank you.
Your Excellency.
All right. Fellow Malawians, today is day number 317 of our war on COVID-19 pandemic. And it has now been 19 days since I declared a state of national disaster. Are recovering. So we must never give in to despair or hide a COVID infection from health officials. The standing policy of my administration is to save lives. But this can only be achieved when every preventive measure is complied with and every incident of infection is reported. Every suspected infection must be reported to health officials so that they can intervene early and save lives. The importance of saving lives cannot be overstated, for it is daily underscored by the numbers we continue to lose. This past week alone, we lost 161 people to COVID-19. Fathers, mothers, sons, daughters, grandparents, uncles, aunties, in-laws, colleagues, and leaders, including our very own Mte Wambali Mkandawire this morning, who was not only a dear friend and devoted supporter of our cause of national transformation, but was Malawi's greatest music icon and champion of our cultural heritage. We join the bereaved families of all 161 people in mourning their passing, and we devote ourselves to honor their memory by complying with the measures for stopping this virus from spreading. May their souls rest in peace. The status of our response to the pandemic over the past week was as follows. Number one, on testing. In the past 7 days, we have conducted a total of 17,334 coronavirus tests, 29% of which were positive for COVID-19. The good news is that this positivity rate is down from 37% the week before. That is why the restrictions we have in place must be followed by everyone, all the time, so that this downward trend of new infections continues throughout the new month. 29% of our tests being positive means that the number of new infections, though receding, is still way too high. Our goal is to bring that positivity rate down to 5% or less, because that is when it will be safe to ease restrictions and return our society and economy to normalcy. Testing is important because it helps us track positivity rate, which is why strengthening our testing sites is a critical component of our response. Last week, I mentioned that I had directed that an additional 77 testing sites be established, and I can report that 62 of these have been completed, while 51,500 testing kits have been distributed countrywide. We have also stocked our warehouse with 150,000 testing kits, which will last us the whole month of February while a new consignment is underway. At this point, I'd like to announce a significant breakthrough we have made in our laboratory capabilities. For the first time since this pandemic hit us, Malawi scientists at the Malawi Liverpool Wellcome Trust, MLW lab, able to sequence the virus will reduce our reliance on labs in South Africa for that service. As a demonstration of the significance of this viral sequencing capacity, it has been confirmed that the new strain of the virus from South Africa is indeed here in Malawi. This confirms that we were right to treat this new wave with the seriousness it demanded, and so we must stay the course in preventing it from spreading. Furthermore, I have directed the Minister of Health to ensure that our scientists at the Malawi College of Medicine are fully engaged in these developments within our labs. Taking ownership of our own scientific research into this virus is not only important for national pride, but also for national security in ensuring the credibility and safety of policies and programs that government implements. One practical example where our scientists will be needed as a security measure is in the rollout of yet another breakthrough program that is now well underway. The breakthrough I'm referring to here is that through the COVAX facility, we have finally secured doses of the AstraZeneca vaccine to give as many citizens as possible immunity against COVID-19. The first consignment of the vaccine will arrive at the end of February, in readiness for rollout in March, starting with 20% of the population, which will prioritize frontline workers, the elderly, and those with underlying conditions. Our own scientists in our own labs will verify the safety of the vaccine and will give you full information so that no one is misled by social media lies and propaganda against vaccinations that the scientific community has worked hard to provide to save lives. Let me ask Dr. John Puka, the co-chair of the COVID-19 task force, to share briefly about how vaccines work and give examples of vaccines that we already use safely in Malawi. Dr. Puka.
Thank you. So vaccines is slow or small doses of exposure to the agent that causes disease. When that happens, the body develops antibodies. These antibodies are fighters against the actual disease. So it's more like introducing what will come to prepare the body to mount war against the actual disease. There have been successes of vaccines in the past. We might have heard of a disease called smallpox, which was again as serious as this. This disease is now completely eradicated from the face of the earth because of vaccines. So vaccines work very well, and they have been enough science to do enough preparations to understand how they work in a safe manner, as well as to make sure that they are protecting the population. Usually, for vaccines to work, we need about 60 to 80% of the population to be vaccinated. This, we call it a herd immunity. For example, if you have heard of cattle, usually what happens is you can protect the young ones once they are enough secure ones that are at that point protected. So you protect the young ones because you have enough herd around those that are vulnerable. So once we achieve a good vaccine rate of about 80 to 60%, we will be able to achieve as Malawians in the manner other vaccines have always protected us. Thank you.
Thank you most kindly, Dr. Puga. Secondly, on containment, I want to thank members of the Malawi Police Force, or Police Service, for heeding my call to follow due process in the enforcement of COVID-19 guidelines. I also want to thank members of the Minibus Owners Association for their willingness to lower passenger number at great cost to their businesses in order to help Malawi stop the spread of the virus. My thanks also goes to teachers across the country for following COVID-19 measures in schools. Let me especially thank the teachers of Form 4 and officials from Malawi National Examination Board for successfully administering the Malawi School Certificate Examination, MSc, this past week. Not only was this done in the time frame that I prescribed back in November, but it was done in compliance with COVID-19 safety rules and without any leakage of papers on the internet. As I have said in the past, and so I say it again, the virus spreads by our behavior. And if we each do our part to follow the guidelines for prevention, we will beat this enemy. One place where we are seeing incidents of new infections is funerals. We are seeing funerals without social distancing, with people not wearing masks, and people comforting the bereaved physically, despite the fact that the bereaved was exposed to COVID-19 from the deceased. As hard as it is to change our cultural way of life in the way that we approach funerals, we need to change for the sake of our survival. I have therefore directed the Minister of Local Government to work with councils and come up with guidelines for enforcing preventive measures at funerals. Number 3, on treatment. Those of you needing to report a suspected case of COVID-19 can do so using the hotline 929. I repeat, 929 on both Airtel and TNM. Previously, we had 5 workstations staffed with people to answer calls. But following my directive 2 weeks ago, this has been increased to 22 at the Baira call center. Please make full use of this hotline so that those in need of medical attention can be attended to by medical professionals with speed. Speaking of medical professionals, last week I announced that we would be recruiting an additional 1,380 medical personnel to send to the front lines of the fight. I am happy to report that 1,128 of these have been identified, and they will be receiving their letters of appointment in the next 48 hours, while interviews continue to recruit the remaining 252. Our focus now is to expedite the procurement of personal protective equipment, PPEs, for this army of frontline workers, especially surgical and N95 masks that are depleting rapidly. Another critical instrument that these health workers need in order to effectively save lives is oxygen facilities for treating those who are having trouble breathing on their own. To meet this need, this past week, our health officials supplied 1,500 oxygen cylinders to patients, as I had directed, over and above the oxygen concentrators and non-invasive ventilators that we are also supplying. Additionally, my directive that the oxygen plants at Kamuzu Central Hospital and in Karabe be repaired has also been done, so that this will be great as we move forward. I am also happy to report that a group of engineers from the Malawi Engineering Institution, MEI, have designed 2 solutions for supply of oxygen to COVID-19 patients. My task force is reviewing the designs so that the implementation can be effected in due course. The ingenuity of our own engineers in this fight is something we all ought to applaud. Although the work of treating COVID-19 patients in these health facilities is done at Kamuzu Central Hospital, have already been transferred there and are receiving high-quality, life-saving care as we speak. We owe our thanks for this accomplishment to the Malawi Engineering Institute for this achievement. I have asked Mrs. Videlia Moyo, who is leading the team of engineers doing this work across the country, to give you an update on the progress of our team is making across the country. Mrs. Moyo.
Your Excellency, sir, it is an honor to stand before you to speak about the initiatives the Malawi Engineering Institution is undertaking in response to the COVID-19 pandemic. First of all, Your Excellency, allow me to thank you and your government for operationalizing the Malawi Engineering Institution Act number 13 of 2019. The Malawi Engineering Institution is established by an Act of Parliament which was passed in 2019. The Act came into operation on 1st October 2020 pursuant to a government notice made by the then Honorable Minister of Transport and Public Works, the late Honorable Zodiak Mia. May his soul rest in peace. Following Your Excellency's call for concentrated efforts in fighting the COVID-19 pandemic, with the surge of the COVID-19 cases, hospitals are failing to cope, including bed spaces. The Malawi Engineering Institution responded by mobilizing its membership to support the Ministry of Health with technical expertise so as to have isolation centers set up and associated equipment installed across the country. The enormous needs led to prioritization of central hospitals to have adequate bed space. The works commenced at Queen Elizabeth Central Hospital and later scaled up to Kamuzu Central Hospital, where upon the interaction, we were directed to work at the Bingu National Stadium Field Hospital. As an update, construction of tents, walkways, toilets, and oxygen plant at Queen Elizabeth Hospital are in progress. Works in Mzuzu are still at planning stage, awaiting completion of oxygen plant design and cost to solicit finances. Your Excellency, at Bingu National Stadium Field Hospital, the engineers, which included the civil, electrical, mechanical, as well as biomedical, have worked tirelessly to support the Ministry of Health in establishing the COVID-19 response facility. The work was planned to be completed by 29th January 2020. The team worked hard, and I'm pleased to report that the works have been completed within schedule. Fire safety has also been dealt with where vandalized fire hydrants have been fixed. At the same Bingu National Stadium Field Hospital, assessment for power supply was done by the team of engineers, which indicated that a single fault would affect power supply to the whole room, which would take more time to restore. In addition, the socket's capacity were inadequate in relation to the medical equipment to be installed. That is, most of the sockets were around 20 amps as well as 30 amps, while other equipment need up to 60 amps. Hence, designs were done separating the power supply system to a point in each ward, from the supply point to the socket outlet accessible to each bed. The design approach was to avoid overloading the existing system, to segregate the supply, the circuit, and discriminate faults within one ward that should not affect the other wards, and to allow quick and easy access to restore power when it trips, since the control breakers have been provided for each room. Your Excellency, the system has been installed without interfering the existing Bingu National Stadium wiring. Your Excellency, sir, allow me to mention that all the works done by the engineers at Bingu National Stadium to enable the work. A list is being maintained and will be published in due course. Further thanks to Minister of Health for partnering with the Malawi Engineering Institution. The institution is open for partnership to support your cause, Your Excellency. Let us all play our distinctive role by masking up, washing hands, sanitizing, as well as maintaining the social distance. Thank you, Your Excellency.
I'm most grateful, Engineer Fidelio Moyo. As you can see, different groups are each doing their part to help Malawi win this fight. Next week, I will give you an update of all those who have so far contributed material and money to our fight in response to my plea 2 weeks ago. But you too, as a citizen, must continue playing your part. Wash your hands, wear your mask, watch your distance. I want to thank you for listening. God bless you, and God bless Malawi. Thank you, Engineer Moyo.
Thank you.
Thank you, Dr. Fuller.
Thank you very much.
Bless you.
Tamva mtsogoleri wa dziko lino Dr. Lazarus Chakwera akuyankhula ku mtundu wa Malawi maka pa nkhani yokhudza mliri wa COVID-19. Ndipo nthawi ino tsopano mtsogoleri wa dziko lino akutuluka mchipinda chino mmene amayankhulira. Ndiye pamene mtsogoleri wa dziko lino watuluka mchipinda chimenechi, nafenso kulutsa kwathu tilekezere pamenepa, ndipo kuti timveke tinali ndi mainjiniya athu Rafael Kasawala komanso Ospencio Hara. Amene atiyendetsa ndi Yohane Kumbanyiwa ndi Stick Tabulo. Choncho malo mwa anzanga amenewa ine Raymond Katayika tsopano ndikubwenzereninso ku nyumba yathu yolutsira mawu ku Chichiri mu mzinda wa Blantyre zikomo.